Good morning or good evening, wherever you may be in the world. I'm Penny Barnard. I'm in Cape Town, South Africa, and I work in a pediatric primary care clinic and have done so for quite a while. Today, we're going to be looking at McWhinney's 9 principles and applying these principles of family medicine to mother and child consultations in the primary care setting. The first principle is an open-ended commitment to patients. And we're talking about being committed to the current situation, what the mother has brought the child in for, and to continuity of care. That means we are committed to the health of the patient, the health of the family, and the health of the community onwards. In maternal and child health, there's always more than one patient in the room, and obviously we need to communicate well with the mother and also talk to the child and even the pre-verbal child. So in order to be committed, she needs to feel safe and that it's a safe and trusting environment. And we do this by creating a physically safe space and an emotionally safe space. So some of this is very obvious. We greet, we're warm and interested from the very beginning. Talking to the baby is incredibly important because it models communication. There must be a place for parents to sit. And I've said here, listen, 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 because it's very easy to do quite a lot of talking, but you listen to the story and you listen to the things that are not said between the lines, and you listen for cues and for clues when the story doesn't seem to make sense. The mother must feel heard and she must be comfortable to ask questions, and this empowers her. Mothers do need a cheerleader. I feel very strongly about this. There was a small study done where they interviewed mothers after consultations and asked what the best thing about the consultation was. And mothers generally came up with the fact that the doctor said I was doing a good job. And that was more important to her than anything else that had happened in the consultation. So, in order to be committed, we need to have unconditional positive regard, and this is showing patient respect and acceptance for who they are as an individual. We also need to be showing empathy, and that is understanding the context of the patients and their lived reality and how their past and present experiences influence what is happening in their lives right now. And empathy is often explained as being in somebody else's shoes. And I love this little picture. This other picture shows a doctor who's looking so full of empathy as he's communicating with this mother and this child. The second principle is an understanding of the context of the illness and the consultation. So ideally, we would like to, in an ideal world, we would know the patient and know the family, but that's not always possible. So at least if you know the mother's name, know the child's name, and know the child's age, it means that at the very beginning of this consultation, when you're starting your observation, you can see mother-child interaction, you can look for developmental milestones, and you can look at how sick the child looks. Um, the, an example of this is that if a 2-year-old comes in not walking, it might be because there has been a developmental milestone problem. It might be that the child has an osteitis, or it might be that the child's just very sick and feeling awful and the mother's carrying it with great empathy. Frequent consultations may indicate that there are other problems in the home. The third principle of family medicine is the use of all visits as an opportunity for prevention or health education. Now, I just love this because I love finding these opportunities. I have listed them and I'm not going to go into all of them. Breastfeeding, weight and nutrition and milestones are fairly standard things that we assess in clinics. Family nutrition is interesting because we all know that alongside malnutrition and undernutrition, there's obesity. And so it's important to know what is the family eating, what is the 5-year-old eating, and what are the habits of nutrition, and how and where are they sourcing food, and sometimes they might need help with nutrition. Immunization is important, and to keep that on track so that it actually all happens is very important. And things like oral and dental health. When the mum says, "Doctor, my child has got 4 teeth in the last month," it's an opportunity. It's an opportunity to say, "Oh, that's super. Let me have a look at those teeth, and how are you managing to clean them?" So all of these conversations are opportunities. Mental health, I'm very happy to say, I think we're a little bit more aware of these days. We'll be looking a bit more into mental health and in the future, and also looking into infant mental health, which is a subject that we will be unpacking. Hygiene, sun awareness. Some countries get this right. Some countries have got programs and a lot of awareness. Stimulation of the child and mother-child interaction. This is such an important thing to be looking at and educating on. Then there are global threats and food security, migration. Imagine not knowing where you are going to be living in the next month or year as a mother. Climate change, we know, has got huge health implications, from extreme heat to floods and tornadoes and things, but we know of mothers who had spontaneous loss of pregnancy because of extreme heat, and of children that are being brought up in very, very hot conditions, not helpful to health. And then conflict and war, and pictures that we've seen makes us feel very helpless in that area. So the opportunities are there, but some of the questions that are important to ask are there any risk factors facing this mother-child dyad? So it's quite a good thing to have a little list of things that you could go through, and a little list of things that you might provide some information on or ask some questions about. The important thing is, what can I do today to promote health and prevent illness? You're not going to be able to do it all, and definitely not in one day, but to find things that are really important for this particular situation. Principle number 4 is viewing the practice as a population at risk. And this is a commitment to health of patients beyond the mother and child that are sitting in your room. And it implies that we need to have conversations about screening visits, about immunizations, and all the interventions that affect population groups. It's also a commitment to keeping good records and statistics. And for many people, including myself, this feels like a real drudgery part of a job. But it's very important when records are currently show that there's decreasing immunization trends worldwide. So it's important to know how your healthcare facility is faring. Are we keeping up? Are we covering what we should be covering? Are we educating enough? And what are we doing when things are showing decreasing trends? Principle number 5 is the use of community-wide networks of support. Knowing how to refer to other healthcare providers and following up on those referrals, checking that the patient actually managed to get to that referral, is important. It shows commitment to care, and that is principle number 1. I said earlier that these principles would be linked. Community resources are often an absolute lifeline to mothers and to parents in general, and especially mother-child facilities for mother support, child stimulation, where mothers are taught how to educate and stimulate their child, postpartum depression facilities, and then financial support can be absolutely vital. So you can't do all of these things, but you can refer and make good referrals, which does make a huge big difference to the mother. Principle number 6 is doctors share the same habitat as their patients. Now, it's not always possible for doctors to be living within the same community, but at least we need to learn from and about the community that we're serving, so that when the mother and child are there in your practice, you actually understand them in their context. Principle number 7 is care of patients in the office, at home, and in the hospital. And this is linked to a couple of the other principles, and that is the opportunities for education, because if we have empowered the mother to know how to care for mild illnesses within the home, we're going to be saving resources. And she's also going to feel empowered and know she must know when it's appropriate to consult a clinic or when she can actually stay with looking after the child at home. I've put here management of good resources, which is one of the principles we are still getting to. Principle number 8 is to have a recognition of the subjective aspects of medicine. That is recognizing that the system and patients often see health and illness from different perspectives. It's a case of balancing the wisdom of grandmothers with clinical assessment and respectfully coping with both perspectives. And lastly, principle number 9 is an awareness of the need to manage resources. So resources are limited worldwide. No country in the whole world has endless resources, but we need to balance what is needed and what is responsible to use on this particular child and mother that's sitting in your office, and how that is going to impact on another mother and child who might need those resources even more. It's a very tricky task to be allocating resources, and we always want the best care for our mothers and children. Some of the stories that I love are where there has been small expense and big impact. And there's a story of the friendship bench, which originated in Zimbabwe probably about 20 years ago. They noticed that there was an increase in depression in a certain community in Zimbabwe, and increase in common mental disorders, and they trained lay health workers in non-directive counseling and problem-solving counseling, and put some benches outside certain clinics. These benches were a place where conversations happened. Patients could refer themselves to the bench, so you could self-refer to the friendship bench, or the doctors sent the patient through to the friendship bench. Obviously, there were still psychiatrists, but there were only, at the time, there were 10 psychiatrists in the whole of Zimbabwe. And there was measurable improvement in mental health in that community. And if you just Google the friendship bench in Zimbabwe now, you will see that this has multiplied to so many different clinics. And in fact, they are even putting friendship benches outside schools for teenage mental health challenges. And I just think it's such a fantastic story to end on. So I would love to say thank you and just to have a quick look at these lovely pictures. The top left-hand corner has a healthcare worker who is having such joy chatting or interacting with a child. The next picture is a mother who is talking and communicating in baby language probably, but that smile is all that baby really wants, is his mother's face, his mother's smile, and his mother's voice. The picture on the bottom left is a young mother who's breastfeeding, and she doesn't look very old, but I want to say I'm delighted that she's actually doing the very best thing she can for that little baby by breastfeeding that baby. Of course, in the center, we have mothers and we have fathers, and fathers are a very, very important part of this baby's life. And this is an adoring mom and dad looking at their little tiny person. This is kangaroo care, which is sometimes done skin to skin, but it's a very important part of bonding and to be encouraged in all healthcare settings. The bottom central picture is just a wonderful picture of a father who is having fun with his child. His child obviously has a disability, and it's not impacting his interaction. It's not impacting him seeing his child as beautiful and with potential. And I'm so happy that that child has this father, because I feel like she's going to really benefit by this relationship. And then, of course, things are not always easy. Mothering and parenting comes with extreme exhaustion. It sometimes comes with depression. It comes with its difficult times. So this mother is looking very, very tired. So tired that I really feel as if I want to just go and look after the baby for the afternoon and let her have a sleep. I hope that somebody will do that for her. Um, Underneath, we have a few sick children who are lucky enough to be in good hands. I can see that they are being looked after. And then at the bottom is our little person in the big shoes. And I also see him as a little boy who is going to grow into these shoes and be the next generation of people who look after other people. Thank you so much. It's been so lovely chatting, and I hope you've enjoyed this as I have. Bye bye.